Good evening, parents. On the occasion of World Breastfeeding Week 2025, Parent Tune welcomes you all to this interactive live workshop where we are going to focus on a very sensitive yet very overlooked aspect of motherhood. A problem that is incredibly common yet very rarely talked about. The psychological challenge of breastfeeding and the feelings of guilt, that shame, and disappointment associated with it, which often result in the postpartum depression. Breastfeeding is believed to be the most natural and beautiful part of motherhood. And while it certainly can be many mothers, it's not the same for everyone. We often speak of breastfeeding as the most natural and beautiful part of motherhood. While it certainly can be for many mothers, it can also be emotionally complex and a challenging journey for few of the mothers. A survey conducted in 2018 suggested that 70% of mothers in India itself struggle with breastfeeding challenges, yet the majority of them continue to nurse their baby for a year or even more. Many breastfeeding mothers continue to suffer in silence while single handedly fighting the feelings of this guilt for not being able to produce enough milk, or the shame for feeding formula for their babies, and the disappointment for not meeting the societal expectations that they have been given throughout. What adds to these is the lack of informed support from people around them and the immense pressure to get it right on the very first day itself. Often left unacknowledged, these feelings keep piling up emotionally, leading to the postpartum depression, a problem that not just affects the mother but also her bond with the baby. This workshop is a small initiative to highlight these often overlooked challenges of breastfeeding and address them with informed support. Today, we have with us clinical psychologist and wellness enthusiast Ms. Richa Agrawal, who will elaborate on the topic and answer some common queries related to this topic. Ms. Richa, thank you so much for joining us today. Please share your
Thank you
thoughts.
for having me. Thank you for having me, Ania. Before we dive into answering this particular question, can we just take a moment to acknowledge something? Breastfeeding, na, it may be natural, but so is gravity, and that doesn't mean that it's always helpful. From leaky shirts to latching fails and unwanted advice from every auntie in your radius, every mom has a story to tell. So let's talk about the real stuff, because while breastfeeding is often seen as beautiful and natural, for many moms, it's also emotionally very challenging. Guilt, shame, not fear of not being good enough are more common than we think. And when left unspoken, they can deeply affect a mother's mental health. And her bond with the baby, it really is affected very badly. I'm really glad that we are talking about this today because every mother deserves support, not judgment.
Thank you so much, Richa. That was incredible. That was incredibly insightful. I'm sure this is going to help all the new mothers, especially those who are pressurized by the way you have said, all the aunties and all those ladies in their radius. So, to before we go any further, I would like to invite all the parents once again to this live session. And I want to tell you all that during this workshop, Miss Richa will be answering all your questions live. So, if you have any queries related to this topic that we are discussing, please feel free to share them with us in the comment section, and Miss Richa will surely address them. So, Richa, my very first question to you is, it is often said that breastfeeding comes naturally to every mom. So, what are your thoughts on it? Is it true?
As I just told you about the gravity part, no, it's entirely not true. And that's completely okay. वैसे ब्रेस्ट फीडिंग को एक नेचुरल बायोलॉजिकल प्रोसेस तो ज़रूर कहा जाता है, बट इट डज़न्ट ऑलवेज़ कम नेचुरली टू एवरी मदर. Many women they struggle with latching issues, pain in breast, milk supply concerns, or even the overwhelming mental and emotional toll it brings along with it. ये expectation कि ये easy होता है often leads to guilt when it isn't. It's important to normalize that हर mother का experience जो है ना वो unique होता है और valid होता है. Struggles do not make anyone less of a mother. Honestly, अगर babies they would have come with a manual or an FAQ section na, so we'd all be thriving. All mothers would be thriving. But no, we get milk ducts, sleep deprivation, and Google. That is it.
Thank you so much, Richa. The way you have put this up, this is really appreciated. And this information, I'm very much sure, is going to help a lot of mothers who are watching this Facebook Live. There are some more questions that I would like to ask you, but before we continue, I want to let all the parents know that we are taking questions on this live. If you have any queries, please feel free to write them down in the comment section. Moving on, Richa, what are some early signs that suggest that a mother is struggling mentally and emotionally while breastfeeding?
On this note, ना, I remember a patient of mine who said that, "Ma'am, मेरी breast इतनी tight हो जाती है कि my baby is not able to suck it at all, and I feel really bad about this. That what kind of mom I am. I can't even feel my child." क्योंकि breastfeeding को इतना normalize किए कर दिया होता है कि they feel that it's wrong. So, which drags all the moms into the vicious cycle of guilt, shame, log kya kahenge, due to perceived failure or judgment from the people around us. Anxiety, what about what, like, baby, if I'm giving my enough nutrition to my baby or not. Feeling isolated, especially when one feels they are the only one struggling. Resentment ho sakta hai, fatigue ho sakta hai, when the mother feels her body is no longer her own. These emotions can deeply be rooted in unrealistic जो सोसाइटी की एक्सपेक्टेशंस होती है ना अनरियलिस्टिक, उसमें ये सारे डीपली रूटेड होते हैं, एंड द साइलेंस अराउंड दीज इश्यूज मेक्स मदर्स फील इवन मोर अलोन.
Of course, and we often see a lot of mothers who are struggling in silence, yet we are unable to understand, we are unable to differentiate between them and just consider that they are just overwhelmed and do not care about them. This is quite alarming. Now, that brings me to my next question. How can mothers differentiate between their normal postpartum blues and serious emotional challenges related to breastfeeding?
See, postpartum blues जो है ना, they are usually short term, lasting about maybe say 2 to 3 weeks, and it involves lots of mood swings, irritability, हर time रोना आता रहता है. They generally resolve over the period of time with proper rest and good support from the family. But if these emotions they persist beyond 2 weeks, it interfere with your day-to-day functioning, include intense sadness, hopelessness, या बेबी से डिस्कनेक्टेड फील कर रहे हो आप, तो इट माइट बी मोर देन जस्ट द ब्लूज, possibly postpartum depression or anxiety, which may be triggered or worsened by breastfeeding struggles. अगर वो फीड करते हुए और ज्यादा स्ट्रगल होता है तो वो इस सिचुएशन को बहुत ज्यादा एग्रोवेट कर देता है. That's when the professional support is required.
And Richa, is there any relation between breastfeeding struggles and the postpartum depression? Can one lead to another? Is it possible?
Yes,
What?
yes, yes, absolutely, absolutely. The pressure to breastfeed perfectly, along with pain, exhaustion, and feelings of failure, can all contribute to emotional distress. जब भी वो अनमेट एक्सपेक्टेशंस जो है स्लीप डिप्राइवेशन के साथ मिक्स हो जाती है एंड लैक ऑफ सपोर्ट भी हो साथ में, तो इट कैन लीड टू और वर्सन पोस्टपार्टम डिप्रेशन. इन फैक्ट मेनी मदर्स दे डोंट रियलाइज दैट देयर स्ट्रगल इज नॉट जस्ट फिजिकल बट डीपली इमोशनल. ये समझ में नहीं आता है उनको, मदर्स को, बिल्कुल. सो दैट वेज दे नीड क्लैरिटी.
And also, we have discussed about this shame, this guilt associated with breastfeeding, especially to those new mothers. I want to understand what are the most common reasons why women feel shame and that guilt related to breastfeeding.
See, they feel shamed. जो उसका रूट होता है ना, it always lies into the unrealistic expectations and social pressure. They may feel shame for using the formula if enough milk is not produced by the mother, guilt if they stop breastfeeding too early. They feel inferior if they can't produce enough milk, judged for feeding in public. But beyond all these social expectations, there's one more challenge, that is extended family dynamics. Often well meaning elders or relatives, they give advice based on their own experience. बट जैसे पता है आज की मदर स्पेशली जो जेन जी और मिलेनियल वुमेन है वो बहुत प्रोटेक्टिव होती हैं और ज्यादा इन्फॉर्म्ड होती हैं बिकॉज दे हैव सो मच ऑफ information available online and they always prefer evidence based practices. उनको कोई नुस्खे वुस्खे वो आराम से मानती नहीं है उस चीजों को. Because of all this, it creates a silent emotional conflict at home. Mothers, they may feel judged or pressured, yet don't want to disrespect family. This unspoken war, this adds to their emotional load, making them feel like they're failing, not just as mothers, but as daughters or daughter-in-law too. That's why it is crucial to bring empathy and clear communication into these conversations, both within and outside the home.
While this is very sad learning about the struggles that women go through, that too silently. So, I want to understand, Richa, can these emotional struggles that new mothers are feeling in breastfeeding affect the bond between their baby and the mother? Is it possible in any manner?
Yes, definitely. It's very important to remember this thing that bonding, jo hai na, it is not only limited to breastfeeding. When a mother feels anxious, exhausted, or disconnected, it can temporarily affect her ability to bond with the child. But ये permanent नहीं होता है, and support say it can restore the women can restore that bond very beautifully by maintaining the eye contact, cuddling the baby, talking to the baby, playing with the baby, and simply being present with the baby. I'd also like to share something very important over here. One of my clients, a new mom, she struggled deeply with breastfeeding in the first few weeks. So, वो इतना overwhelmed or guilty, or she used to blame herself constantly for whatever was happening with her. इवन दो वो अर्ली चैलेंजेस धीरे-धीरे पास ऑन होने लगे, लेकिन अ ईयर लेटर शी केम टू मी फीलिंग स्टिल इमोशनली डिस्टेंट फ्रॉम हर चाइल्ड. शी केप्ट वॉन्डरिंग व्हाई आई डोंट फील द कनेक्शन. मेरा बच्चा रो रहा होता है जोर-जोर से, लेकिन स्टिल आई डोंट फील कि मैं जाके उसको चुप करा दूँ, मैं क्या करूँ? एंड उसकी स्टोरी ये शो करती है कि जब इमोशनल पेन जो है अनएक्नॉलेज्ड या मिनिमाइज होता है, इट डजंट गो अवे, इट गेट्स इंटरनलाइज्ड. And if you are a mother and you are noticing ongoing emotional numbness or detachment, please know this. ये आपकी fault नहीं है. It is never too late to seek help.
Surely, seeking help should always be an option, and new mothers, especially, should understand and do not hesitate to reach out and seek help from people around them or professionally. So, Miss Richa, how can mothers like rebuild this confidence and connection when they have had a difficult start with breastfeeding?
You see, it all starts with self compassion. अगर हम like if we instead of focusing of what didn't go well or what didn't go as planned, celebrate what you are doing right now. Start Try talking to other moms. आप अकेले नहीं हो इस वॉर में, बहुत सारे पेरेंट्स हैं जो इस चीजों से स्ट्रगल कर रहे होते हैं. प्रैक्टिस स्किन टू स्किन कॉन्टैक्ट विद योर चाइल्ड. लेट गो ऑफ कंपैरिजन कि आप अपने आप को कंपेयर करो कि इसकी मदर तो इतना अच्छा फीड कर पा रही है या मेरी मदर तो कर पाती थी बट आई एम नॉट एबल टू डू इट, एज द पीपल कम एंड टेल यू कि ये तो इजी है, इसमें क्यों तुमको टेंशन हो रहा है या बुरा लग रहा है. देन एंगेज इन बेबी लेड प्ले. Seeking guidance without shame, that is the most important thing which you can do. Confidence grows when we stop judging and start nurturing ourselves. So basically, first thing which we should do is that we should stop judging ourselves and get in the loop of stop getting into the loop of self blaming. So that is the best thing which we can do.
Now, Richa, in continuation with the situation that you mentioned about your one of your patients who was a new mother who felt that detachment, I want to understand what can a mother do if she feels somehow she feels that resentment or emotional detachment during or after feeding sessions.
So you love your baby, but when you've been a 24/7 milk bar for weeks, it's okay to want a little break. So even superheroes, they need naps and snacks and alone time, either in their bathroom or in their bedroom, whatever is your preferences are. So these feelings are more common than you think, and they don't make you a bad mother. If at all this is happening, acknowledge the feeling without any guilt. Take breaks if possible and allow someone to take care of the baby at that very moment. Practice journaling, deep breathing to release that bottled up emotions. See, when you are into that zone of like your postpartum and everything, so you don't get the awareness of कि मैं क्या करूं, how should I feel better. So इसीलिए with self awareness we can do all this. And best thing to do is talk to a counselor or a lactation expert who understands these feelings. And remember, emotions जो होते हैं ना वो signals होते हैं, verdicts नहीं होते हैं.
Now that brings in the curiosity from within me, and I want to understand. Could you please elaborate more upon this and tell us what are some simple mental health practices or techniques that new mothers can use during emotionally tough feeding days?
See, some easy and effective practices. The best thing which anybody, not only the breastfeeding mothers, but anybody in their life, if they practice different kind of breathing, it really keeps you grounded and makes a good effect in your breathing system. So, I generally prefer is box breathing. So, in this, we inhale for 4 seconds through our nose, hold for 4 seconds, then exhale through our mouth and then again hold for 4 counts. So 4, 4, 4, 4, it is a box breathing. So doing it 20 to 25 times morning and evening, it really work wonders. And then we can go ahead with affirmations like either talking negative to ourselves, we can talk like, I am enough. This is hard, but it's not my fault. And I'm taking whatever best I can take out from myself. I'm doing that. I'm giving my best. Then you can have a mindful touch, like feeling the baby's skin, noticing your breath while keeping your hand on your chest, and journaling also. It is a very good way of taking that frustration or anxiety out from you. Even write down even small wins, like your baby smiled today, or else you felt better today, or anything, any three small wins of the day, you can write it down. Then main thing is stop googling. Don't google any of your symptom because that brings in lots and lots of anxiety. So go on digital detox, reduce your social media if it triggers self doubt. Even a few minutes a day can help restore calm.
I'm sure these practices will be a lot helpful for all those mothers, those new mothers, especially who are struggling in silence. But what role can professional counseling or therapy play in helping mothers cope up with breastfeeding related stress? Could you please elaborate on that?
You see, actually, therapy, जो है ना, it gives you a very safe space and a very non-judgmental space where a mother can voice out her fears, her guilt, her emotional pain. So a trained counselor can help her process the trauma related to birth or related to feeding. They can help you reframe your negative belief system. I am not enough. So we can reframe it. You can learn it under guidance. Then you can learn certain coping skills and improve communication with the family. See, what you cannot tell your family directly when we go for a family thing, like if we or couples come together or a family with a family, a mother or grandmother is worried, so she will come. they will talk, then we can explain it in the session why is it important to support her and make informed choices confidently. Sometimes just being heard can start the healing process and make you feel far, far better.
Now, as we are discussing about this, we are getting a lot of questions coming in from the parents. So let's start taking questions from the parents. The very
Sure.
first question is from Anjuna, and she wants to understand, on days when I am not able to breastfeed my baby properly, I have this feeling of guilt which drains me emotionally. What should I do to overcome this? What would you suggest?
Anshika, that's a very valid question, and it's okay. It's okay not to, as we have discussed, like it's not important that uh, see, you are giving your best, but if it is not happening naturally, so we can take support of the top feeds, as your doctor has suggested. Like you can give this if the breast milk is not sufficient. And please, I would definitely tell you never, never bring yourself in that loop of guilt, because breaking that loop, the earlier you can, will help you come out of that zone. So जितना जल्दी आप उस zone से बाहर आओ कि because see, you are giving your best. It is not that you at your end are doing lacking some vacuoles or leaving some certain things at your end. It's not happening naturally. So tell yourself, I am doing good and I'll keep on practicing what I want to do for my baby. So there is no guilt in this, and there can be times when this may happen. So just be self compassionate towards yourself. That is what I could suggest for you. That is the best thing which you can do.
I hope, Anjana, that was helpful to you. Now, moving on, we have another question coming in from Rita, who wants to understand, what are the signs of postpartum depression in new mothers?
In thanks for asking this question. But see, in like depression can come in various colors. For every person, for every individual, the symptoms may be different and may be same. So, like you can feel like out of the blue you start crying without any reason. Sometimes it is that some people, they have the habit of showing the anger towards a spouse or towards the family. And see, one thing which I would definitely recommend to the family members, see, because the way you will treat the mother, a new mom, during this period, she will never forget this throughout her life. So be very supportive for the new moms in a way, so that they can, because this is the zone when they really feel deep negative inside. That, like the symptoms, if we say, you can have sleeplessness night, you can have like crying. As I said, you may be not enjoying those things which you used to enjoy previously, but don't worry, these all things are temporary. They will settle, अपने आप ही settle हो जाएंगे within 4 5 weeks. It will come down to normal. If it exists beyond those time, then it is very important that you should seek help from a psychological counselor.
Another question is coming in from Achal, who wants to understand, my baby is on formula feed as I'm not able to produce enough milk, and although कोई कुछ बोलता नहीं, I constantly feel everyone around me is judging me. तो मैं क्या करूं? What would you suggest?
See, Achal, I have a very simple line for you on this question. Like, instead of assuming, ask. या तो आप assume मत करो कि कोई क्या सोच रहा है, और अगर आपके assumptions आपके ऊपर dominancy हो रही है, तो you just simply go and ask. Like, एक simple सा question. Sometimes there is nothing in other person's mind, but what we are bringing in our mind, it creates havoc in our mind. And जो वहां पे कुछ है भी नहीं, still we are feeling, making a hill of a mole. So it is always good to ask the other person the question. And सबसे पहली चीज होती है कि I always say कि अगर वो चीज आपको फील हो रहा है कि you are doing wrong, then it will definitely show you on any other person's mind. So आप पहले तो just make it clear that, or like, it is not in my hand कि मैं, like, I am not doing producing enough milk. It's not in my hand. So I cannot keep my baby hungry. So I need to feed her or him. So because of that, I'm using formula milk. So there is no point of judgment in it. So until unless you are clear in your mind, तब तक आपको किसी की बात बुरी लगेगी नहीं. अगर यहाँ आपको क्लैरिटी है ना, nobody else, whatever they may say, you will not feel bad about it.
Another question is coming in from a Kavita who wants to understand. I don't know why, whenever I have to feed my baby, I often feel anxious and even cry at times. Is this normal? What would you suggest?
What is the age of the baby? Can we know? Like, is it a very infant, or is it like a month? That
So,
ways it would
Kavita
be
hasn't
crucial.
mentioned the age though, but we can still try and answer it.
Yeah, definitely. So, if it is the early part of your like postpartum, like if you are in your, like, your baby is a month old or 2 month old, then if you are feeling such things, so what, like, it is very normal to feel that way, Kavita, कि आपको रोना आ रहा है feed कराने के लिए, and sometimes the hormones have a very big role to play. Like, some disturbances are happening because of the hormones, but we take it personally and we feel like something is wrong with me, something is wrong inside me, so I need to take care of that thing. So वो चीज का ध्यान रखना बहुत जरूरी है कि मतलब we should cater to those things first rather than thinking this way.
Another question is coming in from Simran, which I believe a lot of mothers must have. And she's asking, I live in a joint family, and ever since my baby was born, everyone constantly sits in my room. I have absolutely no privacy while feeding. I have tried speaking to my husband about it, but he doesn't think there is anything wrong with the situation. And I feel really uncomfortable. So, what should I do? What would you suggest?
Simran, you had a very good point over here, and lots of mothers must be facing this thing, and they are not coming out openly. And I think we also missed out this question. Like, a partner's role is very crucial. Emotional validation, practical support, and simply being present can make a huge difference. Sometimes the best support a father can offer is not fixing things, but fetching some snacks and nodding empathetically while mom wins. वो आपको हाउसहोल्ड, आई नो, आई एम जस्ट टेलिंग यू लाइक हाउ द वेज इन which your spouse can be helpful, but he is not helping right now. So that is why it is very important to make him understand. And see, because what I suppose is you are living with the in-laws right now, and your spouse comes and he doesn't find anything wrong in it. So I think it is always good whenever you go out next on your session, like with your doctor visit, take him along and let your doctor know in prior about this, or else you can talk to him directly one on one, that this makes me feel this way and I need your support in this. All I want is you just listen to me. Whatever I'm venting out, just don't need answers. Just, these are few days things which I want to do with you, and it would be very grateful and very helpful. See, always communication is the best thing. Although you try to communicate with him, but still let him know how everything which is people around you, feeding in public, everybody sitting around you doesn't make you comfortable. And it really brings, and even the hormones are playing so much in your mind. So I think the best thing which you can do is either talk yourself with your husband openly and communicate what it makes him feel, what makes you feel, and let him understand. If that doesn't work, then definitely you should ask him to seek a help with you. Like, you can say that I need to take help, so you have to come along, as he has an equal role to play as a father.
Exactly. Our next question is coming in from a mother named Priya who wants to understand. At times, I don't feel like breastfeeding, but I have to do it anyhow. I feel irritated and cranky most of the time because of this. So, does this mean I'm not a good mother?
See, Priya, it doesn't mean that you are not a good mother. Definitely, you are a very good mother. That is why that question is coming from you. Otherwise, you wouldn't have dared to ask this question. So, it doesn't mean that you are not a good mother, but there are certain times when we don't want to do certain things. Maybe we are feeling very tired. Maybe we are feeling emotionally burdened. Maybe we are not getting the enough support from outside. Maybe we are ourselves not feeling good from inside. So it doesn't mean कभी कभी होता है ना कि we have to do difficult tasks just because वो important है. Sometimes see when your baby will grow up or maybe you have an elder child, when you have to send your baby to school, you don't feel like getting up, but still you get up, get the child ready, and you know, bam, you send the child to the school despite of not giving like not feeling like sending him. So it's similarly there are certain things जरूरी नहीं है कि हमारे मन मुताबिक हर चीज हो. So sometimes if we need to fight for it कि करना है तो we can feel that way. It's completely normal. और कभी कभी you can delay the process by 5-10 minutes. ठीक है, I'll just rest for 5-10 minutes, then I'll come back to this feeling part. So that way you will feel more better in doing that. I hope that helps.
Hope this was helpful to you. And now, moving on, we are getting a question from a father named Webhuff, and he wants to understand. My wife gave birth 2 weeks ago, and she is really struggling. मुझे बिल्कुल भी अच्छा नहीं लग रहा. She is crying most of the time. मैं ऐसा क्या करूं जिससे कि उसको better feel हो जाए? We should appreciate this question coming in from a father, definitely.
Definitely, definitely. It's really very appreciative of him. And see, as I discussed right now, what you can do is you can help her out with certain household tasks so that she can rest. You can reassure her that she's doing her best. And you can attend all the lactation or pediatric appointments together with her. You can encourage professional help if it continues for a longer period of time. And see, Weber, the most important, sometimes the best support you can offer her is don't try to fix anything for her. कुछ भी उसके लिए फिक्स करने की जरूरत नहीं है. बस वो जो आपसे कह रही है उस टाइम पे, वो गुस्सा हो रही है, चिल्ला रही है, बुरा लग रहा है, वट एवर शी इज स्पीकिंग आउट, लेट हर वेंट आउट. Don't react to whatever she says. Just empathetically, you just listen to what she has to vent out. और कभी कभी उसको कुछ अच्छा सा स्नैक ला दो, या आप while you are coming back from the office, you can, to pamper her, you can bring her a flower or a snack of her taste. So that this is the best thing you can do. Otherwise, आप ज़्यादा ये करोगे कि अच्छा मैं क्या कर दूँ, अच्छा मैं क्या कहूँ, मैं क्या बोलूँ, तुम कैसा ठीक फील करोगे, that will never help. But being there without saying anything is the best thing which you can do.
Or to say in other words, going back to the dating phase would help
Yes.
them, their
Actually, yes.
wife and the new mother. So now that brings a new question to my mind, Raja. Could you please help us understand, especially for the fathers, how can they play a crucial role apart from these, somehow to help their partner who is a new mother and still struggling, who also cannot speak out clearly what she is struggling with because she herself is unable to understand what the real
मुझे हो
situation
क्या रहा है.
is. So if you can also throw light on that.
See, actually क्या है ना, having the education, like psycho educating yourself about the emotional changes which motherhood can bring in the counterpart, in your like female part of the couple. So that understanding, it goes a long way. If that the father is understanding the emotional situation rather than saying कि क्या तुम तो सारा दिन रोते रहते हो, you are always crying, why there is a need to cry, you have such a beautiful baby in your lap, then what is wrong, why are you crying? So instead of saying these things, you can emotionally validate her feelings. You can tell her, yeah, I know how you are feeling, I this is such a big thing you are going through, I'm always here, like whatever you need, I'm always here. and practically support करें उनको, rather than just in words. कई parents तो, कई fathers तो in words भी नहीं support करते हैं, but practical support जो है, that is very important. Practical support as in like help the mother in nappy changing of the baby, take care of the baby, let the mother sleep. Like supposingly mother didn't sleep the whole night, you can take care of the baby, take the baby to the another room, or else mother can go to the other room and have a quick nap and take rest, give rest to her body, or book an, a spa appointment. These days we have so many like spas that are coming to your home. You don't need to go outside. So you can book a surprise spa for her. That will definitely make her feel very good. And the most important thing which you can support your wife in is like, if you have extended family members living in your family, so just try to maintain that good balance between the your parents and your wife, because that is the very, very, very important part, which takes a lot and lot of emotional toll on the like breastfeeding mother. So that is the things which you can do, like, I think.
This will surely help not only the breastfeeding mothers, but all the wives out there. I'm very much sure of that.
Very sure, very sure. Yeah.
Now, moving on, we are getting a question from Farhana who wants to understand breastfeeding and baby care के कारण मैं अपने हस्बैंड को टाइम नहीं दे पा रही हूँ. अब ऐसा लग रहा है जैसे वो भी इंटरेस्ट लूज कर रहे हैं धीरे धीरे. हार्डली बात करते हैं मेरे से. तो ऐसी सिचुएशन में मैं क्या कर सकती हूँ जिससे ये सिचुएशन ठीक हो सके? What would you suggest?
पर हाँ ना, कभी-कभी ना, just fear of missing that love bond between you and your husband, that creates that kind of anxiety कि आगे ये मेरा relationship जो पहले था अब ऐसा नहीं रहा, and it's definitely वैसा नहीं रहा because you have become parents to a child. So वो चीज तो ठीक है, but ये just remember one thing, this thing is just temporary. As the child will grow, as you will get time for each other, then this bond will develop with a double strength. So rather than holding on to the fear of losing that connection with your partner, it is always good to stay in touch. That the way I was telling that अगर आप baby से connection feel नहीं कर रहे हो, तो you should have that, skin to skin touch with your baby. You should try to, be more, talk to your baby whether he will respond or not, because such a small baby will not respond, but you can talk to build that connection. So communicate openly to your partner about your feelings, what you feel, and also try to spend more time when the baby is along with you. You can together take good care of your child. So being doing certain things together for your child can help you spend more time together and stay connected with each other. And if at all you have the privilege of, somebody else taking care of your child, so just take a half an hour every day with your husband alone. That is also a thing you can do.
Even that is important. Gradually becoming parents, they should not forget that they are a couple as well and should work
Yes,
on that as well. Now, the
definitely.
next question is coming in from a concerned mother named Nitya who wants to understand. जब से बेबी हुआ है मैं केवल रोती रहती हूँ. मिल्क भी नहीं आ रहा है ठीक से, कभी वो रोता रहता है तो मैं कुछ कर भी नहीं पाती. तो क्या ये किसी तरह से पोस्ट पार्टम डिप्रेशन के सिम्टम्स हैं? What would you suggest?
Yeah, like it seems like the postpartum depression part only, and it's very important to know that how old is your baby, how long have you been in this cycle of crying and feeling not feeling good enough. So this is very important thing you should consider. If it is going beyond 6 weeks, then I would recommend that you should definitely go ahead and seek a counseling session so that it might help you, or else you can contact your gynec. She can also guide you to some other psychologist or such kind of help and let you find the path towards it. And see, if it is early period, then it is quite understandable that hormones are playing games in your mind and you may be feeling, not not in a good mood, not enjoying the things that you used to enjoy, feeling guilty about not taking care of child sometimes. सी अगर गिल्ट आ रहा है दैट मीन्स यू लव योर चाइल्ड इतना ज़्यादा कि नोबडी कैन मेजर दैट लव फॉर द चाइल्ड। सो ये लेकिन गिल्ट को हमें अपने ऊपर हावी नहीं होने देना है। दैट इज़ द बेसिक थिंग व्हिच यू शुड अंडरस्टैंड। सी एट द एंड ऑफ द डे हम सब ह्यूमन्स हैं, सो वी शुड एक्ट लाइक वन। वी आर नॉट गॉड्स और वी आर नॉट सुपर मॉम्स। वी वांट टू बिकम सुपर मॉम्स कि मैं ये भी कर दूँ, ये भी कर दूँ, ये भी कर दूँ। It's okay if you're not able to do that. And tell this to yourself. Keep a hand on your heart. It's okay. I'm doing my best. What best I can do, I'm doing, and I'll keep on doing. Nothing can stop me. And कभी कभी you're feeling low, you feel like रो लो यार थोड़ा सा रो करके अच्छा आंखें भी साफ हो जाएंगी. But if it is happening too much, then we need to seek help.
Of course, similar to this, we are getting a question from Deep Shikha who wants to understand. Uh, मैम, जब मेरी पहली बेटी हुई थी लगभग 5 साल पहले, तब पोस्टपार्टम डिप्रेशन के बारे में सुना नहीं था, बट अब इतना कॉमन हो रहा है। एंड हमने तो हमेशा सुना है कि ब्रेस्ट फीड करना है नो मैटर व्हाट। मेरी छोटी बेटी 3 महीने की है और मुझे अब समझ आ रहा है, बट फैमिली को नहीं समझ आ रहा। सो व्हाट शुड आई डू? व्हाट वुड यू सजेस्ट?
See, Dipshika, what one person can do is we can change our way of thinking towards the other person, but we cannot the other person standing right in front of us. So it would be similar to banging your head on the wall. So instead of going and asking them to change, it's better you change your perspective. See, you think it that way. Ki, this has to be this only. I need to mend my टॉक अराउंड दीज थिंग्स। मेरे को बार बार जाके उनको कुछ साबित करने की जरूरत नहीं है। आई एम नॉट गोइंग टू गो एंड ट्राई टू कन्विंस देम फॉर व्हाट आई फील इज राइट। सबका अपना अपना पर्सपेक्टिव है एंड एवरीबडी कैन फील दिस इज राइट और दिस इज रॉन्ग। सो आप जब तक आप इस वॉर में लगे रहोगे कि मुझे अपने आप को सही साबित करना है या मेरी बात सही है, स्टिल दे आर नॉट अंडरस्टैंडिंग, दैट विल नेवर हेल्प you. That will only backfire to you because either the other person whom you are trying to explain that will come and fight with you, or else when they will disagree to you, you will not feel good about it. Then you'll go back to your room. Either you'll fight with them or you'll go back to your room, start crying. So it's always good that you just try to change your way of your perspective toward the situation and do। कहते हैं ना, सुनो सबकी करो अपने मन की। जो आपको ठीक लगता है आपके बच्चे के लिए है, do that without feeling fearful कि वो लोग क्या कहेंगे, because you know that you are doing best for your child.
And without that feeling of guilt, of course.
Yes, yes.
Now, Richa, we are getting a lot of questions pouring in from the parents, but unfortunately, there's a time constraint and we cannot address to each one of them. So, just to sum it up, I would really appreciate if you could share any 3 suggestions that you would want to give to the mothers who are watching it, to all the new mothers related to this topic today that we are discussing.
या सी ब्रेस्ट फीडिंग जो है ना बहुत इमोशनली चैलेंजिंग हो सकती है और नहीं भी हो सकती है। इट इज नॉट कि सभी के लिए इमोशनली चैलेंजिंग होगी, बट इट्स टाइम वी it's good that we are talking about this openly. So 3 things that you should remember: you are not alone, your struggles are valid, and your best is enough। जो आप बेस्ट दे सकते हो वो इनफ है, उससे ज्यादा आपको हाथ पैर मारने की जरूरत नहीं है। So if you've ever cried over spilled milk, literally, or felt like hiding yourself under the covers during a feed, you are in a good company. So let's replace mom guilt with mom's grace. So let's keep replacing the pressure with the empathy, and every mother deserves that. That is what I have to say.
And of course, I would also request you to please give one message for also not just the mothers, but to their family or to their partners. How can they try and help? In just one line, what would you suggest them?
Just be present. That is the only thing. And always give the validation of what the your wife is feeling। See, postpartum जो है लाइफ लॉन्ग नहीं रहने वाला है। It will just stay for few weeks or few months, so bear that for few months। So that is the best thing you can do for your for the breastfeeding mother।
Thank you so much, Richa, for this insightful session. This was wonderful, and I hope this was helpful for all the parents, all the mothers, especially who are watching this. Thank you, all the parents, for joining in.
Thank you for having me.